From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz. Emergencies with pets can happen at any moment, and it's not always easy to know when it's time to rush them to the emergency vet. You've probably been there before. Your pet isn't acting like themselves, and panic sets in. Is it time to go to the emergency vet, or can it wait? Acting quickly can often make all the difference in your pet's health outcome. Some emergencies are more obvious, like visible injuries, while others, such as sudden lethargy or unexplained behavior changes, might be harder to spot. In this episode, Dr. Stevie Aitken, an experienced emergency veterinarian, highlights situations when a trip to the emergency vet is absolutely necessary. Dr. Stevie is a traveling emergency veterinarian with extensive experience treating pets in critical situations. Dr. Stevie, it's so great to have you. Welcome.
Thank you.
Your expertise in the pet emergency field is something that I want to learn more about. Being that you've experienced so much with pet emergency, what are some things that you take and apply to yourself in an everyday situation with you and your dogs?
Yeah. I think the thing that I've applied the most is I'm just overly cautious. I've seen it all. I have seen really things every day that continue to astound me. And I think it has created a bit of just an overcautiousness in myself with my dogs. They are never off the leash. They are always within my sight. I'm just very careful with them in a way that I probably wasn't before. You know, knowledge is wonderful, but it's also a little scary.
Yeah, absolutely.
So, I proceed with a little bit more caution in my dog's everyday life than I think I would if I wasn't in the
I
field.
can understand that. All right, so a question off of that. Do you ever look at people and kind of cringe, or just like, oh, no, don't
Every
do
day.
that? Yeah.
Every day. The two scenarios I would say that really cause me to like, ugh, don't say anything. Sometimes I do say something. Puppies at public parks, just like wandering on the ground when I'm like, that dog does not have all its vaccines, is one of the things that like makes me cringe the most. I just like see parvo in the environment. And owners driving with their dogs in their laps. It makes me physically ill.
Really?
Seeing them, free dogs just climbing all over in the vehicle. The thing that nobody thinks about or wants to imagine is if your dog's in your lap while you're driving and you get into an accident and that airbag deploys, like you're not winning. No one's winning in that scenario. And so small dogs just having free reign of the car it just kills me to see.
Yeah.
Yeah.
So I know ER situations can get extremely intense and chaotic. What would you suggest to a person bringing their dog in an emergency situation?
Yeah.
What would be your recommendation to try to keep things as calm as possible? What advice would you give?
Yeah. So I think one of the things that can alleviate stress, right? It's always when you go into an emergency vet, you're going to be stressed. You are going to be. There's no like magic thing that I can say to tell you to just like calm down and it's going to be fine, because it might not always be fine. But one of the things right off the bat that can help alleviate that stress on the front end is knowing where your emergency hospital is. If you don't know where your animal emergency hospital is, especially for like a 2 a.m. or a Sunday night when your primary care isn't open, or maybe they are, but they can't see you, just know where that is, because not every town, not even every city has a 24-hour emergency hospital. And so knowing where to go in the event that something does happen can already decrease that stress of you like getting your phone up and trying to Google and you're like, oh, this one says it's open, but it's really not. And you don't know where it is. So that can be very, very helpful. And then when you're going in, just knowing that everybody in that building and in that room is on the same team as you. So understanding that like we want what's best for your pet. We want to make sure that they're not suffering. And so even if you go in and we're not matching your energy of like being up here, that's okay. We've seen it before, and we are going to do our job to make sure that your pet is not in pain, they're not suffering, and try and get you answers as well. And so just understanding that if you feel like we're not feeling your urgency, I promise you we are. We are, but we use that to create a plan. And so we just want you to understand that like we know that it's serious. You wouldn't be here if it wasn't serious.
Yeah.
And so we're all on the same team, and we're going to help you and your pet.
Yeah. And you're a trained professional. You've been here before. So it's their first emergency,
Yes.
you know, but you've seen it time and time again.
Sometimes every day.
Yeah. And I agree with people definitely want you to like match that urgency or at least appear to. But the reality is the best way to handle the situation is going to be calm, poised, calculated,
Absolutely.
and focused and ready to go.
Yes.
Yeah.
You don't want your emergency veterinarian or any emergency professional, human or animal,
Yeah.
panicking. You don't want to walk in with a hit by car and them go, oh my gosh, I've never seen this before. So yes, you want them to have that cool, calm, collected, I've got this, I've got you. Like that is the energy that you want when you walk in the door.
I've had clients say that to me. Side note, they're just like, oh, you're handling that so well. I'm like, thanks. Could you imagine if I wasn't? I was like, if I looked just like you handling your dog, it would not be a very good look at all.
Exactly.
Yeah.
Somebody's got to be the level-headed
For
one.
sure.
Yeah.
All right, Dr. Stevie. So dogs are dogs. Animals get into things. Stuff happens. I want to talk about the most concerning moments.
My life advice for pet owners is sort of treat your pets like toddlers. If you would do something or wouldn't do something with a toddler, don't do it with your dog.
Okay.
So if you know that you would take your toddler to the emergency room in that situation, your dog's probably the same.
Okay.
So if there's blood in their vomit, if there's substantial blood in their poop, if they are bleeding from a nose. So this is one caveat sort of to that life advice is dog nosebleeds are not the same as human nosebleeds. They don't get them from allergies or altitude or those kinds of things. Exactly.
Yeah.
So if your dog ever has a nosebleed, they need to go to the vet.
Yeah.
If you see blood around the eyes or anything like that, they should go. If it's a small wound, it might be something that's worth like a photo or a call to the vet to say like, does this need to be seen? But the blanket to this as well is if you're concerned, just come in. The best thing that can happen is I get to say, oh, I don't need to see you today.
Yeah.
See you later.
What about a dog let's say not being themselves, being a little bit more tired? What would be like the determining factor for you to say you should come in?
Yeah. So big things when we talk about lethargy is sort of a scale of how lethargic. Is it like we went to the park, we ran around for a good while, we're just exhausted, and we bounce back to ourselves in a day? That's totally normal. If it's a dog that, because they can't talk to us, right?
Yeah.
Like I always value that change in behavior even greater than some of the other things, like say vomiting, for instance. If they're just vomiting, maybe we do give them a day, maybe not. It depends on, the dog and how much and how long and those kinds of things. But if it's something and lethargy, so if they're vomiting and they're super lethargic, you need to get them seen. Again, best case scenario, maybe it is just a belly ache, but anytime there's that change in behavior, they don't want to get up, they're not greeting you at the door like they usually do, those kinds of things, those are much bigger red flags to me, especially in cats. Cats are so stoic, and so they naturally want to hide pain, they want to hide discomfort. If they start becoming lethargic, they're hiding, they have that behavioral change, that's something that even if nothing else is going on, they need to be seen.
That's important. Yeah, good to know. Do you find that sometimes people don't really know their dogs well enough to know the difference?
Sometimes. It depends. It's such an interesting conversation, right? Because our culture has definitely shifted to where pets are becoming more and more parts of the family. So you have extremes of like people that never stop looking at their pet and they call me at 2 a.m. Yeah. They call me at 2 a.m. and they're like, oh my God, she sneezed. And I'm like, oh, okay, maybe go to sleep.
So you've met my wife?
Yes. We had coffee right before this. Exactly.
She's at 3 breaths per minute now or something. I'm like, it's okay.
Yeah. Which honestly I love. Like it is helpful because they know their pets so well that when they say this isn't right. I had one recently that was a dog that truly the only thing off was had a little vomiting a couple weeks ago and then was normal and then got lethargic. But to me, the dog came in and was bright and was active. But for the owner, she was like, but this isn't her and this isn't her normal behavior. And through a series of tests and multiple visits and things, she was diagnosed with Addison's, which is a disorder associated with their adrenal glands. And it was truly the dog wasn't in what we call crisis with Addison's, and truly only because I can attribute it to that owner's diligent knowledge of that pet's behavior and change that I would not have caught on just a general exam. To me, she looked great. And then you have the other extreme of there's still dogs that are kind of, you know, outside dogs, or, you know, they're just an animal, not necessarily a pet or a family member. And so it is interesting, like that dichotomy of the field of understanding and also knowing where to see, okay, maybe you have just been staring at your pet too long. Versus this is serious and we do need to take it seriously. But you're also your pet's biggest advocate. They can't speak for themselves. And so speaking for them is super important. And if you see something that is different, say something so that we can investigate it. And best case scenario, we can tell you you're overreacting. Hopefully.
Go home,
yeah,
rest.
Exactly.
It's okay.
Exactly. Yeah.
For me, I think it's a very common thing, and I don't get worried at all. My concern would be when a dog is vomiting and nothing's coming up, and also if it's just happening continuously.
Yes.
So I'd love to hear more from you about, like, when is it an emergency and when is it like, they'll be okay, give it a day or two.
Yeah, absolutely. And it is tough. And even I will preface this with, until I see your pet, I can never guarantee that it's not an emergency, right? I have seen dogs throw up one time and it's been something really big, bad, and scary. And I've seen dogs throw up all night long. They look, walk, talk like a foreign body obstruction. And they just have an upset tummy. So until you see them, you can't totally say, but I think some good kind of rules to have in the back of your mind is if they are vomiting with any behavior change. So if they are vomiting and lethargic, vomiting and anxious, aggressive, change in behavior, those are big signs that we should go in. Vomiting profusely, meaning like they're just not stopping. It's vomit, one after each other, or they've just been vomiting continuously for an hour, 2 hours. They need to be seen. Even if the cause of the vomiting is an upset stomach, they ate something silly, they can get dehydrated really quickly. There are things that can go along with that vomiting that can cause more issue. And so I would say just getting them in, and hopefully at a minimum, they just need some anti-nausea, some fluids, and they feel better. It's always better to be safe. If it keeps happening, or if there's any blood in the vomit, or anything weird coming up, coffee ground material, that's a good time to go for sure.
How about like hacking? Because there's definitely a difference between that and then potentially a dog that might have an obstruction. That's more serious.
Absolutely. And so like with that hacking and that throat clearing, water's a good idea. I caution people, unless you know what you're doing the syringe, because especially our smush face breeds, like our Frenchies, things like that can be dangerous. But offering like a treat to get them same idea to swallow and kind of push that through is super helpful. And in that scenario, I would say if it's sort of their normal, obviously doesn't warrant a vet visit, but if it's something that's really out of the abnormal, or if you know they've just been chewing on something, or there were chicken bones in the trash, things like that, then again, always better to be safe. And so getting them in and having it checked out is a good idea.
Great. Let's talk about the other end of the dog. What about struggling to urinate?
Yes.
Or even go to the bathroom. Poop?
Absolutely. So this is a topic that people love to talk about. People love to evaluate the poop and see what's happening back there. So for defecation, so for pooping, if there's blood, maybe not like a drop, right? If they've been, having some changes going to the bathroom, we just changed food or something like that, and there's a drop of blood, I get a little less worried than it coming out the front end. But if we're just pooping out puddles of blood, we have to go to the vet. And then for the urinary tract, that's where we get a little bit more serious. So I take it very seriously if there's blood in the urine, even if it's just a simple UTI or something that's not what we would think of as life-threatening. anything with the urinary tract can escalate very quickly. So even if it is just a UTI, well, that infection starting in the bladder can go to the kidneys very quickly. That can result in very scary things like sepsis and much larger things.
Gotcha.
So I take urinary changes very seriously.
Okay.
So if we are straining to urinate, especially in our cats, if you have a male cat that is going back and forth to the bathroom, he's going in and out of the litter box, he's straining, maybe he's getting little drops out or he's getting nothing out at all, that is a true emergency and that warrants being seen sooner rather than later.
Gotcha.
Same with blood in the urine of a male cat, needs to be seen very quickly, versus a female animal or even a male dog is a little bit different. That's something that we deal with a lot on the ER side. Is male cats like to get urinary obstructions where they actually can't physically pee. And that is a very, very life-threatening emergency that you have to deal with quickly, because if you can't pee, you can't live.
Yeah,
So
definitely.
we need to see them.
Well, on that note, how about excessive urination?
Yeah. So excessive urination can go along with a lot of underlying disorders, things like diabetes or endocrine disease, or even some changes in the brain. And so it is something that should be seen.
Okay.
Whether that's like a 2 a.m. visit, maybe not. It sort of depends on what else is going on with that animal. If you feel like they're going out to go to the bathroom a lot, they're drinking a lot of water, they should absolutely be seen.
Okay. Yeah, good to know, because I can see how excessive urination could be a cause of concern, and maybe somebody would want to go at 2 o'clock in the morning knowing that the dog has urinated a lot and drank a lot of water during the day. Well, okay. I want to talk about loss of mobility, or just a dog that might be just struggling to move as well as they have before.
Absolutely. So mobility encompasses a lot of things, right? So there's a lot of emergencies sort of popping into my head. And when we start talking about loss of mobility, if your pet is ever in pain, and that could be as simple as an ear infection, right? Like on the other end of the spectrum is a lot of people wouldn't think that's an emergency, but if your pet is in pain and suffering, that always constitutes an emergency in my book. So even if we overdid it at the park, we're limping, yes, they could probably walk it off or give it a day or two of rest and they'll be fine. But if they're uncomfortable, you can always come in and we will get them situated with some pain meds and then talk about rest and recovery. If your animal suddenly loses the use of a limb, any animal, anytime, front, back, legs, I don't care, they need to be seen immediately.
Okay.
Several things that can be going on, especially we know like in our dachshunds or our long back dogs, or now we know in our Frenchies, sorry, Frenchie friends, there are a lot of things that go on with you. We deal with a lot of back injuries, and it doesn't even have to be something that they jumped off the couch or they, took a tumble, they tussled with another dog too hard. It can be they stood up too fast and they tweaked their back.
No way.
But it can go from a simple back pain to paralysis very quickly, especially in our Frenchie friends. And so if you ever notice, especially in those back legs, that they are dragging a leg or they suddenly can't get up in that back end, they need to be seen really quickly, because that could be something that warrants emergency surgery or something more.
Wow.
Similar in cats, if a cat ever loses the use of its back legs, that needs to be seen immediately, especially in cats. No trauma happens out of thin air, and that's something that needs to be seen really quickly. So those would be things that, like, yes, you're getting up at 2 a.m. and you are going to the vet.
So seizures are a pretty, I would say, in my experience, a very common problem or issue in the dog world anyway. What would constitute for you a seizure that definitely needs now to be handled by an emergency vet such as yourself?
Yeah. So a seizure is something that if an owner calls and says their pet has a seizure, I will always say, come in. If you want to come in, even if it's the first time it's ever happened, they look fine now, you can come in. A seizure is something that when we start to break it down, we're thinking of things in the brain or outside of the brain. And there's lots of hard and fast rules with our neuro patients, our neurology seizure patients. So without getting too nitty gritty, if a dog is older, so if a dog is really older than like 6 or 7 and they have a first time seizure, they should be seen, because the risk that it's because of something else happening in the body is really high. There's also a risk anytime that there's a seizure that they could have a toxin exposure that you aren't even aware of. And so it's always good to rule those things out. If a dog is a first-time seizure, and they are between about the ages of 6 months to 6 years, it does increase the possibility that it's just idiopathic epilepsy, meaning we don't have a reason for it, or it's just a misfiring of their brain. And I use air quotes because that doesn't mean that it's necessarily going to have a better prognosis. Some of those seizure dogs do get very serious very quickly. So it's always good to have those checked out.
Gotcha.
If your dog has more than one seizure within 24 hours, they have to be seen. If a seizure lasts more than 5 minutes, they have to be seen.
Okay.
Those are really hard and fast parameters of like, you need to get to the emergency vet, because if we start having more frequent cluster seizures, or if the seizure lasts more than 5 minutes, we start to get into the area of like true brain damage and things that we can't come back from. And so it's really important to just take them in. But I would never, if somebody calls me and they're like, my dog just had a seizure, I want to come in, I'm never going to be like, you can just wait on it.
I could say, I mean, first of all, a dog having a seizure is a very hard thing to watch.
Awful.
Like terrible to watch.
Yeah.
What do you think in your experience is like a common cause for it? Because I've heard there's different reasons why they can have seizures. I've even heard of dogs having a reaction to medication, like flea and tick medication, that causes them to have a seizure. So is there a common factor for you in your experience, or is it kind of just, you know, a crapshoot, so to speak?
Yeah. So between 6 months and 6 years, our number one concern becomes epilepsy. So again, that misfiring of the brain. Now, certain breeds, there's other things that can be underlying. Toxin is always on the top of my list. So they got into something that causes seizures. And we say toxin because anything can be a toxin in the right dose. And there are certain dogs that have genetic mutations and things that can predispose them to seizures after, you know, certain medications. And so even if it's not a true toxin, it's something that we keep in the back of our mind. Once we get greater than about 6 to 7 years is our cutoff for a first-time seizure in a dog. Older than that, my suspicion for a brain tumor goes up really high. And that's why I encourage people, even if it's a first-time seizure, they came out of it really well, if they're older than that, like middle age cutoff, I would just have them seen and make sure that there's nothing more to that. Obviously, tons of other things that could be going on. Fungal infections. We see metabolic disease. So in cats, we'll see, electrolyte derangements and things that can cause it. In a cat, any seizure needs to be seen. I don't care the age. I don't care how long it lasted, if it was a first time, because cats don't get seizures for really good reasons. So it's better to be safe in cats than wait on it.
Gotcha. Yeah, I would have no idea. I would assume it's a lot like a dog. Like,
This is my favorite saying that we were taught in vet school is cats are not small dogs.
That's a good point.
They're a totally different realm, and they do things and handle things very differently than dogs. Some similarities, right?
Yeah.
But cats are not small dogs. So they really don't like to follow a lot of the textbooks too. I always joke with my owners that they can't read the textbooks, and so they do weird things sometimes as cats. Yeah,
that's a really good point. Cats are not small dogs.
Yeah.
I think I don't have a cat, but if I did, I would need to know that.
Yes,
and I'm glad
absolutely.
I do.
Absolutely. The rules don't apply.
So on the topic of toxicity, what are some situations, like for example, when I think of toxicity for dogs, or a dog consuming something that's toxic for them, my first thought is food. I think of like onions, for example, or grapes, or raisins, which are dehydrated grapes, which I think some people don't know that. Is that if I'm chopping onions and piece of an onion falls on the ground and my dog eats it, do I need to go to the emergency vet, or is it okay to let them poop that out and see what happens?
So I will say, if you're ever not sure, there is a pet poison control line, ASPCA, and there's pet poison helpline, 2 numbers that you can call, and they might be able to tell you based on your dog's weight and what they consumed that you're totally fine. So if you're ever concerned, you can absolutely call and find out that information. And if they do tell you to go to the vet, then you have a case number that your emergency veterinarian can actually call and talk to the toxicologist or the veterinarian and get a whole game plan for treatment, which is super helpful. Some big things that you have to go to the vet for if they eat. So if they ever consume a human medication, you can call poison control, but I would probably do it on the way to the vet, because we know too with medications, they are time dependent most of the time. And so if we can get that out of them, let's say we make them vomit, get it out, we might be able to reduce the severity. Or again, best case scenario, you show up and we get to say, it's totally fine. We did the math and you get to go home. But it's always better to be there, that in the event that we need to intervene, we can. And especially with medications, time is usually of the essence. So if it's a blood pressure medication, well, if we can get them in sooner rather than later, we'll be able to monitor the blood pressure and normalize it if it does start going up or going down. The other thing that is a hard and fast, you have to go to the vet, is xylitol. So xylitol is an artificial sweetener. It is one of the scariest emergencies, toxins that I see, because it starts acting within 30 minutes.
It's quick.
It's very quick. And the effects range from a dip in their blood sugar. So basically xylitol, and this is just in dogs, it doesn't happen in cats. When they consume xylitol, their pancreas releases a massive amount of insulin, and it causes them to go hypoglycemic. So their blood sugar crashes. And that happens really quickly. So that usually happens within 30 minutes. And then depending on the dose, they can actually also sustain an acute liver injury. So they can go into liver failure from xylitol. So it's super serious. And it is also one that, like, if we can get in and either get some of that out, if they've eaten a pack of gum or sugar-free peanut butter, and we can get that out of them quicker, that's super helpful. And so just getting them in fast is really important with xylitol.
Yeah, I'm glad you mentioned peanut butter, because I don't think a lot of people are aware that they put xylitol in sugar-free peanut butter.
Yes.
And other names that it goes by that I'm aware of is birch sugar.
Yes.
Or something to do with like birch wood.
Birch gum, birch sugar.
Something like that.
Yeah.
So
on the label, it might not say xylitol. It'll say that the birch product. And to put some people's minds at ease, because I know they're all going to be running to like check the peanut butter. Your like typical Jiffies, Skippies, those kinds of things. Your just run-of-the-mill peanut butter does not contain xylitol. It's going to be your like all natural, sugar-free kind of situation that usually it's some type of diet product that is going to contain that. So it is something to keep an eye out and not put that in your, toys and things for them to lick out, because that gets serious quick.
I usually recommend for my clients because they'll usually put peanut butter in a Kong. And I have recommendations for that because, one, it can be very high in fat, or it is very high in fat. So they really shouldn't be consuming that much fat in one serving. But what I'll say to them is, if you can, get all natural. Like even some stores now you can grind the peanuts right there. To me, that's the best way. Like that's the best form of peanut butter to give the dogs. But you do what you can. But it's good to know with the xylitol for sure.
Yes.
Have you ever found yourself in a situation where somebody waited too long?
It's such a tough line, right? Because like you even said, like sometimes you want to give it a couple of days, see if they kind of come back to themselves and they stop doing the weird thing or the vomiting. It's always, in my opinion, better to be too safe. It's so much easier for me to look your pet over and either say, we've overreacted, go home. Or even if they are sick, it's always easier for me to get them back to 100% from 80% versus 20%. So it's never wrong to take them in. Now, obviously, an emergency vet trip is not cheap. I understand that. So sometimes you do want to sort of wait it out and see. I think some of the things that we've talked about today, so like the bleeding from anywhere, the vomiting and not producing something. So if we're concerned about bloat, where they're just trying, they can't get anything out, or your male cat is trying to pee and they can't, like those are things that you definitely have to go. However, if you're ever concerned and you just don't know, you can always call as well and say, can I chat with a nurse or a doctor? Let me just tell you what I'm seeing and tell me if I need to come in. And that way we can start to get an idea too of what's coming in the door. So if we do tell you like, yeah, you definitely need to come, we can make sure the team knows and everybody's sort of on the same page. But it's never wrong to like also give us a call and be like, if this was your dog, would you wait it out a couple more hours or would you come?
That's a good point.
Yeah.
Like I said, I tend to be the one to wait. However, I'm not opposed to making a phone call or, bringing the dog to the vet. But I also don't want to overreact too. Absolutely. And I feel like that's where, for me, it can be a little like conflict,
Yeah.
because I don't
Yeah.
want to overreact to something. So I
Yeah.
think a lot of people can understand that. And then you have the other end. And I
Mm-hmm.
feel like it's good to try to find a middle
Meet
ground
in the
for that.
middle, right?
Yeah.
And because they can't talk to us, we don't know until we see them.
Yeah.
And so sometimes we will just say, just come in. The best thing I can do is put your mind at ease. We can get some vitals, we can do an exam. Hopefully they look great and we can send you home. But because we don't know until we see them, it's hard. So it's never wrong to err on the side of
Gotcha.
caution, or give us a call and
Yeah.
say, like, what would you do?
I want to know now from your perspective, is it like, are they repeat offenders? Because I'm telling you, sometimes I get
Ooh,
clients and I'm like, why? Is that something that you see too, where it's like,
yes.
oh, Sally's here with her dog again, and
Yeah.
sorry,
There,
Sally, but but you know what I
Poor
mean?
Sally. Yes. The repeat offenders, especially when they've eaten something it shouldn't. So, like socks, underwear, most of the time when they come in and have eaten that, they've either had surgery before or the owner comes in and says, well, she always passes them. She'll be fine. She poops out socks all the time. So, very common that we have repeat offenders. Yes. But on the other side of that, I have also seen people take all the precautions in the world, and some of those animals are just set on getting that sock or that underwear, or there's kids in the house, it's
Yeah.
not perfect.
Yep.
So it's hard. I've even seen a dog that had eaten a ton of rocks, that was then pretty much living in a basket muzzle when it went outside, and she was still able to get tiny tiny rocks through the basket muzzle.
Oh my gosh.
She was fine. She passed them every time, but you could take every precaution in the world and it can never be perfect.
Yeah.
But we do see repeat offenders a lot for eating silly
I
things.
can imagine.
Yeah.
Yeah. All right,
Perfect.
Dr. Stevie, it is Ask Me Anything, and I'm super excited. We got some prepared
Amazing.
questions for you that our viewers want to know, so I'll jump right in.
Okay.
My 16-year-old dog recently had a seizure, and I was prepared for the worst. But after it stopped, he acted completely normal and happy. Knowing his age, should I still take him to the ER?
It's a tough one. At 16, we know that a seizure probably is not happening for any good reason. So then I would ask you what your goal is, right? Do you want to know the answers behind it?
Mm,
If so, absolutely. And there are things that maybe are manageable or treatable, right? We could see seizures because of kidney disease. Well, maybe we can manage that kidney disease and do some fluids and
yep.
things that can give them a better quality of life for longer. It's a tough one because, yeah, we might uncover, or we probably will uncover something not great,
Yeah.
but that can set up your expectation for what's going to happen next. That doesn't mean that we need to prepare ourselves that day for saying goodbye, but it might give us a timeline of, do we think that this is like a brain tumor? And that'll give us a timeline versus that's very different than kidney disease or liver disease or other things.
I see.
And so it does allow us to sort of know what to expect next. But it is tough.
I can imagine. Next question. How can I tell if my dog has a fever? That's a great question.
Ooh.
How can I tell if my dog has a fever, and what temperature is an unsafe go to the ER temperature?
Great question. Okay, so a normal temperature for a dog is anywhere between 99 degrees Fahrenheit and 102.5. So they run much warmer than us. So I do get people a lot that are like, she feels really hot. Well, our normal temperature is like 98, 98.6.
Yeah.
So if they're 102, that does feel very febrile.
Yep.
One of the best places to check for their temperature is their tip of their ear. So you can feel
Okay.
that. And if that feels really hot, it might be an indicator that they're running a fever. Any temperature, let's say you check their temperature at home, if we start getting north of 103, 103.5, we should go get checked out at the vet. Excluding that they were just outside running around,
Yep.
playing hard, it's summer, that kind of thing. Obviously, if they get up to a little bit higher than their normal, I don't get excited.
Yeah.
But if we're just laying like Logan is, and the ears feel really warm, you check a temperature at home and it's like 103, 103.5, I would say we're probably actually running a fever and we should be seen.
Okay. Follow-up question to that from me. What is the best way for a person to take the temperature at home?
Yeah. So there are now some pet thermometers on the market that you
Okay.
can use in the ear, or you can do like a pediatric ear
Okay.
one. Honestly, the best way to do it, and sort of the easiest that we were even taught in vet school, is you can get a normal human, like under the tongue
Mm-hmm.
thermometer, and tuck it in up under their armpit and
Okay.
hold it there until it reads, and then add about 3 degrees to that. So it's not going to be a perfect core
Okay.
temperature because it's on the external of their body.
Gotcha.
But if it, let's say it reads 96, it's probably 99, and then you know you're normal. Or if it reads 102 under the arm, I would be very worried that you do actually have a fever because
Okay.
you're at that high end of normal just in an armpit. But yeah, you can tuck it right up under that arm and
Gotcha.
and set it there for a minute.
That's good to know because I was prepared for
Yeah.
a completely different response. So,
I promise I am never going to tell you to stick anything up your dog's butt at home. Never.
I was
never.
nervous. I was
Not
like,
a
oh,
finger,
man,
not a
you're
nothing.
going in.
Actually, please
Oh,
don't.
man. All right. Yeah, good.
Yes.
Yeah, don't do that. Okay.
Never.
Yeah, because I'm not going to lie. I was like, that's what I wanted to know.
Yep.
Because literally the other day, my wife was like, I think we should take her temperature. And I was like, I only know one way to do
Yeah.
it. So I don't know if you want to do this. And we have to give up one of our thermometers.
Yes,
So it's just
exactly. Let us be the bad
Okay.
guy. Yes.
Yeah,
absolutely.
like I said, that question was totally from
Yep.
me for sure. All right, next question. My cat has been hiding all day, and she's usually pretty independent and enjoys her personal space. But today she's not coming out at all, and I'm starting to get a little worried. Should I be concerned, or is this normal?
It's a cat, so I would be concerned.
Okay.
When you start having them hide and real strange behavioral changes, I'm much more concerned maybe than even a dog if they kind of have a quiet or an off day, because cats don't tell us something is wrong until it's really wrong. They will hide anything until it's really serious. And so if that is a strong behavioral change from your cat, I would say it's always better to be safe and go have them seen. Could be a stress response, it could be something minor, but it's always better to be safe.
Gotcha. Love it. Thank you. I really appreciate your time and your insight, and to help put all of our viewers' minds and hearts at ease, and to know for somebody like me when it is time to actually take action and bring the dogs to the vet, or cats too. So
Yes, absolutely.
Yeah.
I'm glad that I could help, and hopefully this answers some questions, alleviates some anxiety about the emergency vet as well for anybody that has to eventually end up there.
yeah, thank you so much.
Of course. Thanks for having me.
Yeah, my pleasure.
Through November 30th, 2025, earn an entry for a chance to win $5,000 in the CareCredit Let's Get Digital sweepstakes. Enter the secret word emergency in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States, D.C., and U.S. territories 18 years of age or older who have a CareCredit credit card as of 9/2/2025. Void where prohibited. Promotion starts 10/8/2025 and ends 11/30/2025. Grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.
Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.